This is Larry King with some information you need to know. Odds are you're watching this video because you or a loved one has heart disease, serious heart disease. Well, I know the feeling. Perhaps you've had an angioplasty to clear a clogged blood vessel. I've had 2. Or maybe you've had bypass surgery. Mine was a quintuple. And I don't mind telling you, it scared me into some major lifestyle changes and moved me to help others with heart problems. But if you're no longer a candidate for these life-saving procedures, your current therapy isn't succeeding, and you suffer from angina with daily activity or while resting, you and your cardiologist should know about another treatment option that could significantly improve your heart health. It's called Enhanced External Counterpulsation, EECP. What is it? Well, let's ask the experts. From Duke University Medical Center, Division of Interventional Cardiology, Dr. Lawrence Crawford. Medical Director of the Advanced Cardiac Treatment Center in Vero Beach, Florida, Dr. Nancy Cho. And Medical Director of the Heart-Lung Center of Hawthorne, New Jersey, Dr. John Strobeck.
EECP is a non-invasive therapy designed to help those with heart disease, specifically clogged heart arteries, who suffer from angina.
Cuffs that are separated from each other are placed around the calves, the thighs, and the hip area, and each set of cuffs is inflated in a very prescribed sequence. The result of this sequential squeezing and holding of the various segments allows the blood from the lower extremities to be propelled forward in the body towards the heart and augment the blood pressure that perfuses the heart muscle at a time when the heart is relaxed.
Usually after about the second week or third week, you begin to notice decreased episodes of angina, improved exercise tolerance. And most people see the full benefit of this therapy after the 35 treatments.
We've heard from the medical authorities. What about people like you who've actually experienced EECP therapy? Let's see what some of them have to say. Here's Bob Marino, Patricia Burns, and Don Rick.
Before the treatment, trying to take the dog for a walk was a hassle, really, for me.
When Pat Byrne first walked into my office, she was complaining of chest pains and shortness of breath.
And it reached a point where I couldn't even go a block with her. We had to come back.
I referred her for an angiogram, and that showed a severely blocked coronary artery in the bottom part of her heart.
I always prided myself in being in great shape and being able to do anything I wanted to do, and I wasn't doing that.
Bob had a blockage pattern that involved a major artery and a major side branch of that artery, and it made it extremely difficult from a technical point of view to actually perform an angioplasty that had a high likelihood of success.
Even though I had had the angioplasty, I was still having such chest pains when I would attempt to exercise that I'd stop after a short period of time.
My life before the EECP slowing down as a result of my angina.
Donald has, again, an interesting blockage pattern where he had already begun to form some collateral blood vessels to the area of the heart that had been damaged, but the collaterals were not adequate.
It really was a wake-up call.
What was the EECP treatment like?
In the beginning, I didn't know what to expect when I walked in there, and I thought, oh gosh, what am I in for? But after I was put on the bed, hey, it was fine.
The initial feeling of when they inflate the cuffs has the body move up a bit from the bed and down, but it's not a frightening sensation.
The basic treatment itself I found actually very fulfilling. I mean, after I got finished with a day's worth of the treatment, I just felt good.
How well does EECP work?
Over the 3 years, I've really treated a lot of patients, and it's very impressive how well they do.
My energy level is generally quite high.
I'm back to walking 3 miles a day and doing the yard work and painting.
Well, I'm exercising on the average of 5 days a week. And when I'm not exercising per se, I'm pursuing some sort of activity like skiing or hunting or fishing.
I have personally been involved with 600 patients that have received EECP therapy, and fortunately it's turned out to be a very safe and effective treatment for those patients.
When we evaluate all of our statistics, we're finding that between 75 to 80% of patients will respond to an initial 35-hour course of treatment.
How safe is EECP?
EECP has been shown to be very safe.
How effective is it?
Fortunately, there is a lot of data to support and substantiate the effectiveness of EECP. There is an international EECP patient registry which now has followed over 5,000 patients who have received this therapy. And when you take a look at the data from that registry, it says that benefit is maintained in about 80% of the patients.
It was amazing because after the treatment, the angina disappeared. I was able to live the type of lifestyle that I really wanted to live.
The oldest person I treated was 97 years old, and she's turning 100 this year. This lady was in hospice, crippled with chest pain. She couldn't get out of bed without having severe squeezing pain in her chest. She was on morphine. And now, after these treatments, she's actually traveling around. She completed a cardiac rehab course. It was just amazing.
I enjoy outdoors. I enjoy physical exercise. I was able to resume activities that I always wanted to do without being interrupted with the pain. No pain. Pain-free.
It made me feel good, so I came out of it smelling like a rose.
Are there any reports of negative side effects?
Of the 600 or so patients that I've been involved with, none of them have quit, and the adverse event rate, meaning side effects, complications, has really been much less than 1%.
So who, if anyone, should avoid EECP?
The patient who is a candidate or is considered a candidate for EECP needs to go through an initial evaluation by a cardiologist to be sure that they don't have a severe aortic aneurysm, which is a large dilated area of their aorta, or does not have a severe valvular heart disease that makes counterpulsation less effective.
How often do you need EECP treatment?
You come for ECP treatments 1 hour a day, 5 days a week, for 7 weeks.
Does insurance typically cover EECP?
EECP is now covered by almost every major medical insurer in the country, including Medicare.
My insurance carrier totally paid for everything.
Medicare takes care of the payments, thank goodness.
I've treated patients starting 3 years ago, and several patients have had no other treatment, and they continue to improve.
So when you talk to your doctor or your cardiologist and you have symptoms that are related to clogged heart arteries, then this may be a very effective treatment for you.
There you have it. Enhanced external counterpulsation, EECP. Non-invasive, safe, effective, affordable, and in most cases you're covered. Doctors Crawford, Cho, and Strobeck, and EECP patients, Mrs. Byrne, Mr. Marino, and Mr. Rick, thanks for joining us. If you think that EECP may be the answer to your heart health challenge, call 1-800-455-EECP or log on to www.eecp.com to get the location of the nearest EECP Therapy Center. Finally, these thoughts. You know, your heart is more than just a vital organ. Since time immemorial, the heart has been known as the seat of the soul, the home of the spirit, the source of courage and compassion, hope and love. EECP is one of many ways you can take better care of this precious part of you. So do something now to safeguard and improve your health. Talk to your doctor about your cardiac condition. Ask about EECP. Get all the information, make an informed decision, and then take action. Take it from me, you can't go wrong if you use your head and listen to your heart.